I am Dr. Pankaj Tandon, Atomic Energy Regulatory Board, Mumbai. We are talking today is radiation safety in nuclear imaging and radionuclide therapy. In this particular topic, we have various objectives. First and foremost thing is the advancement taken place in nuclear medicine till date, different diagnostic and therapeutic products in nuclear medicine, radiation safety aspects during handling of radionuclides, radiation protection for nursing staff and visitors, optimization of radiation dose to non-target tissues, and management of radioactive waste. It means in this particular presentation, we are going to talk what are the advancements taken place, what are the uses, what are the different optimization process, how the radiation protection we have to take care, what are the radiation safety aspects, and further the radioactive waste which is being generated, how to manage the waste being generated. In past few decades, major advancement in the nuclear medicine practices have been based on the development of new radiopharmaceutical, especially products for radionuclide therapy. It means what? As the time is passing out, different type of radionuclides have been produced. But the most advancement, if you see in last few years, has been taking place in the field of therapy. Also, large amount of doses for even diagnostic studies are in common with the increasing use of technetium radiopharmaceutical, which is the workforce or workhorse we should say for perfusion imaging of myocardium and brain and imaging lesions with peptides and proteins. Accordingly, practice in nuclear medicine departments, particularly in the hospital radiopharmacy wing, have to be very carefully planned, implemented and monitored, keeping in mind the radiation safety of staff, public and environment. When we talk about technetium products, as we all know that conventional nuclear medicine is totally based on the technetium 99M products. Recent generation of technetium 99M products comprise compounds for imaging blood flow to myocardium and brain, imaging lesions such as infection, inflammations, tumor and thrombus formation. Appropriate care and radiation safety procedures should be ensured at all stage formulations, handling, injections and imaging. Actual retention of activity in organ of interest could be just a fraction of injected activity done, with much of the injected activities being corrected into urine over a few hours. It means what? It means to say that whatever the radionuclides which is being administered, which is technetium product for any kind of imaging, we have to be very careful of the urine which is being excreted out in a few hours. Thus, it is not only the concern of exposure to occupational worker and surrounding personnel, but also possess potential contamination problems. As far as radiation safety is concerned, which is the topic which we are talking about today, the most important thing is from the radionuclide which is produced to be administered and finally the waste which is generated in case of excretion of urine in the last of the few hours after the administration of radionuclide. We have dealt with a product which is generator based, technetium 99M. Now we talk about cyclotron products which gives SPECT product. Indium 111 products are mainly useful in cases of delayed imaging needs. Among the most important indium 199 products, a special mention can be made of indium 111 labeled peptides or labeled octreotides for imaging tumors of neuroendocrine origin. It means the SPECT product, the product which is used for SPECT purposes, indium 111 is also playing a very important role, but it is a cyclotron produced radionuclide. Iodine 123, it is again used for diagnostic purposes, but it is also a cyclotron produced radionuclide. Iodine 123 MIBG is a very good marker for myocardial imaging, but due to its logistics problem of accessibility to pure iodine 123 have been precluded wider utilization of this product despite their importance in clinical practice. What does it mean? It means to say We can able to use iodine 123, a very product for most of the imaging purposes, but how to get this product? Because this product is not a reactor produced product, but is a generator produced product having a half-life of 13 hours. 13 hours half-life is very good for treatment and for diagnostic purposes, but because of logistics reasons, it is not much in use because it requires cyclotron for production. Now comes to the PET products. PET products means what? The product which is a positron emission, which is being produced from cyclotron. As we know, when we talk about conventional nuclear medicine, technetium-99 is the workhorse. Similarly, in case of molecular imaging, fluorine-18 is one of the most important radionuclides which is being used in most of the examination. When fluorine-18 is labeled with a compound called glucose, we call fluorodeoxyglucose, it is being used because our cells won't understand when we take glucose or fluorodeoxyglucose. It feels that they are getting fluorodeoxyglucose, and because fluorodeoxyglucose is having a fluorine-18 content in that, and fluorine-18 is a positron emitter, it means you can able to find out the region of what is the problem in the cell at a very early stage. It was originally proposed for estimating regional cerebral blood flow and shown as a good activity during variety of mental functions, since glucose is a source of energy for brain. Similarly, O15 and carbon-11 labeled receptor radiopharmaceuticals are used for investigation in patients for neurological disorder. When we talk about cardiology, FDG is playing a very important on cardiology also, in order to detect the myocardial function or myocardial viability studies. Oncology nowadays, oncology without PET-CT doesn't work. It means PET-CT is very important to find the tumor metabolism or better grading or staging indicator of tumor prognosis. It means when we talk about PET products, it is being used in neurology, in cardiology and in oncology. If you see the spectrum of major therapeutic applications, till now we are talking about diagnostic applications. Now we talk about therapeutic applications. Radioiodine in thyroid disorder, including thyroid carcinoma. When we talk about thyroid disease, we always come across in our mind the isotope radioiodine. Similarly, iodine 131 MIBG in tumor derived from neural crest. Intra-arterial therapy, example radiolabeled lipidol and hepatocellular carcinoma, 120 millicurie activity is used. Intracavity therapy, intrapleural, intraperitoneal, interpericardial, intrathecal, intracystic, radioimmunotherapy, radionuclide therapy for benign disorder like gold 198 or yttrium 90 colloids, which is being used in rheumatoid arthritis and other inflammatory joint disease, and we always use the term sanovectomy. Intravascular radionuclide therapy for prevention of restenosis of the heart muscles, labeled hormone therapy, radiopeptide therapy. It means we started with a therapy for thyroid disorder, and now today we are talking about radiopeptide therapy. The most important thing which we come across in case of radionuclide therapy is how to choose the isotope. The isotope choice should be dependent on the basis of half-life, the energy of particulate emissions, volume to be irradiated, type of alpha emitters, which is Auger, conversion electron emitters, hard beta emitters and soft beta emitter, how easily we can able to produce, and what is the logistics. If we see all these things from Indian context, apart from the well-known iodine 131 and P32, which is being used for bone metastasis, if time was there, when we talk about thyroid disorders, iodine 131 is a choice of isotope, and we talk about bone metastasis, P32. But now there are different kind of radionuclides of high relevance and practicability available like samarium 153, holmium 166, yttrium 90, lutetium 177, rhenium 186 and the combination of 186 and 188 rhenium. Now as you know, whether you use diagnostic radionuclide for diagnostic purposes or radiopharmaceutical for therapeutic purposes. In case of therapy purposes, we all know the activity which is going to be used in much higher quantity. Diagnostic is not much. So, when we talk about therapeutic radiopharmaceutical, owing to the renal route of excretion, patient preparation and precaution for safe discharge radioactivity needs to be taken with the radiopharmaceutical. It means to say that whatever the excretion is taking place from the patient, we have to take care of that also, because finally it is going to give hazard to the environment. Now, there are different kind of radionuclide which are available. I was talking about for synovectomy purpose for the treatment of joints, like samarium 153, phosphorus 32, yttrium 90, dysprosium 166, holmium 166, and rhenium 186, 188, rhenium and gold 198. And these radiopharmaceuticals are being used for the treatment of joints. Now, when we see this particular table, there are different kind of nuclides which are available, which are of potential use in case of therapy. It is started from P32 and finally we talk about gadolinium and their half lives and what type of particle is being emitted, what is different kind of energy. So, and what is the principal gamma available, because when we talk about therapy based radiopharmaceutical, we have to see to it whether what is the gamma component in it, because there are certain radionuclide like P32. If you see in this table, the first slide, first nuclide which is P32, it does not have any gamma, it is a pure beta emitter, and pure beta emitter is always good for the treatment purposes. But we have certain kind of radionuclide which emits gamma also, and gamma, because of Bramstrong radiation, we can able to diagnose to see it whether the radionuclide is at particular position or not. Now, this particular list goes on. It starts from holmium 166 and finally we have iron, though we have many, but still nowadays we are working on lutetium and rhenium based isotope, though we started with P32 and iodine 131. In between we have used holmium, we have used many of the products based samarium 153, but now the choice of radionuclide which is most important being used is for lutetium, and now we are going for rhenium therapy. We are coming with alpha therapy, which is one of the latest technology, being used for the treatment of for the treatment purposes. Now, when we talk about radiation safety, the important thing which come across is the routine, the hospital routine, how to order this radionuclides. Radiation safety does not mean that when we started handling the radionuclides while dispensing, while injecting, but radiation safety plays a very important role starting from the ordering of this particular isotope and then finally how to receive this. And once you receive it, you have to make sure that the package is expect and no unauthorized person will open it upon arrival. It is not an ordinary package, it is the package which is having some kind of labels which tells that it is radioactive. And before unpacking, check the package. In case of damage, contact your RSO and finally inform the regulatory body. So, this is the way I would like to state that radiation safety is not when we talk about while handling the radionuclide, but it talks about while ordering the radionuclide, still unpacking it. Now, we come to the storage, how to store the iodine 131. We have received, though we have received the radionuclide at our end, but again how to store this. And iodine 131 plays a very important role, because iodine 131 is a high energy gamma, 364 kV it comes. When we talk about technetium, it gives 140 kV. The radionuclide should be stored in a controlled area according to national regulation and local rules. We have a national regulatory authority at Atomic Energy Regulatory Board, and we have to follow all the rules in such a way that not only from ordering to received and finally when it comes to your department, how to store this iodine 131. It should always be stored in a lead container. You cannot just keep it outside because it is a gamma emitter. To reach an acceptable external dose rate, an adequate thickness of lead is generally required. A lead container which is meant for iodine 131 may not be used for other isotopes. So, we have to see to it the radionuclide which we are using or radionuclide which we are going to store for temporary purposes, then what basically the choice of thickness of the lead should be there. Otherwise, there is no point. If you are going to store iodine 131 in a glass bottle, it is not going to help you much, because the gamma rays which is being emitted from this iodine button is going to come out. That this particular slide talks about you have to have a proper shielding material for storing all these radionuclides. Now isotope has been stored, now you have to dispense. Dispenses means you are going to make the doses. You need a protective clothing for that. You have to have a lead shields like bench top shield, vial shield, because you are basically dispensing it from a larger dose to a smaller dose. Keep the vial in the fume hood and on a tray with lips lined with plastic bag absorbent pads. What does it mean? It means to say you cannot store the bottle at any places. It should be stored in a proper tray which is having a plastic, which is having absorbent sheets. So even if something goes wrong, the absorbent sheet which is available is going to absorb the spills which has taken place because of the tilt of the vial. Now you have to handle the vial with forceps or similar long handled instruments. Cover the vial with lead after use. The cap of the lead bottle has to be kept back. Check the activity before administering to the patient. Fill in the necessary records. Every point from protective clothing to dispensing to checking the activity and finalizing a record, radiation safety plays a very important role. Now when we have to do the internal transport, what do you mean by internal transport? Internal transport means that you have dispensed the activity in one room, but you are going to take that activity for administration to the patient in the scanning room. You cannot just hold it in a hand and take it. Usually people does like that. You have to internal transport mechanism, so that if the administration of radiopharmacy to the patient takes place far from the dispensing room, you have to have a transport container with absorbent pack. Make sure that a warning sign in on the container together with patient having name, activity and date, so that to avoid misadministration. Try to follow the most direct route, avoiding more heavily occupied area. Usually, regulatory authority always sees to it when the layouts are approved that you should not carry out the work in 3 or 4 different rooms. The activity administration room and the hot lab should be near to each other, so that the activity should not move from one end to other end. What are the precautions to be taken before administration? So that to avoid misadministration. Be prepared for any emergency situations. We have to be. Any kind of work which involves some kind of hazard, we should have emergency plans ready with it. Careful identification of the patient, hospital routine should be followed. Why the patient should be identified? Because it should not so happen the dose which is prepared for one patient, we are going to administer to the other patient. You have to ask different questions to the patient, at least for a lady patient. Are you pregnant? Are you breastfeeding? In case of old patients, you are incontinent, whether you are feeling with nausea. What about living conditions you are having when you go back home? In case of therapeutic radionuclides for therapy purposes, what type of work you are doing? What are the transport you are going to use when you go back home? These questions are very important questions when we are going to use the radionuclides for therapy purposes, because we are going to administer the isotope in larger quantity having long half-lives. Verbal and written individual instructions to the patients should be given. Now we know basic safety series. Now it has come to GSR. Pregnancy, if the patient is pregnant, the registrant and licensee shall ensure for nuclear medicine that. What is registrant? The facility is registered and the name, which is called registrant. The license is the person under whose name the license is issued to use the radioactive material or to procure the radioactive material. They have to ensure when the patient is pregnant that, and at least for therapeutic purpose, that what are the clinical indication whether this can be avoided or not, or whether we have some other kind of therapy available, so that we should not give a radionuclide. So these examinations, whether for diagnostic or therapy in case of pregnant, has to be ensured by registered licensee before radionuclide is to be administered. We have an ICRP annals, and this very well clearly says that radioiodine easily crosses the placenta and therapeutic doses can pose significant problems for the fetus, particularly in permanent hypothyroidism. It means the major problem comes if the lady is pregnant and if you are giving iodine 131 for the treatment of thyroid or any kind of therapeutic dose, then it may so happen the fetus may have a permanent hypothyroidism. In case of breastfeeding, suppose a woman is a breastfeeding age, it means they have a kid which requires to be fed by breast. In case such registered licensee has to ensure that for mother in lactation, discontinuation of nursing be recommended until the radiopharmaceutical is no longer secreted in an amount estimated to give an unacceptable effective dose of nursing. It clearly shows that some kind of secretion takes place. It means these questions are very pertinent and to be asked to the pregnant woman, or in case of breastfeeding woman having a kid which requires breastfeeding, that you have to stop this kind of thing, because otherwise the activity is flowing from one end to other end. As we discussed in the previous slides, the nausea is one of the important things, because you have to ask whether the patient is having NVD syndrome, nausea, vomiting, diarrhea after giving the activity, because sometimes people feel that radioisotopes gives rise to this kind of, because it does not have, but because of psychological problem, if it leads to such kind of incidents, then you have to take the information. You have to talk about living conditions. How many people are living in your house? How many children you have? Whether you have a separate room? What type of work you are doing? What type of children? Whether you are working with children? Whether your co-worker is pregnant? And after the administration, when you are going back home, what type of transport you are using? How much time you are going to be there? These are very important things to know it, because to decide a radiation safety not when the patient is in the department, but we have to take care of their general public, their relatives and their visitors. Safe administration. Any isotope, why we are always talking about iodine 131? Because we are going to give this particular isotope in large quantity. So, whenever you give this isotope, try to give in a control area like hot lab or the patient, hospital bedroom. A plastic bag for contaminated items should be available, as well as paper tissues. The patient is asked to stand on the floor covered with absorbent pads, and the floor beneath the patient should also be covered absorbent pad. Why this is required? Because this is required if you are giving the administration, if you are giving the activity by oral route, and because of some reasons the patient vomit or patient sneeze, the activity comes out. During that time we require absorbent pads. If the iodine 131 is administered in capsule form, nowadays most of the places, most of the hospitals are using the iodine 131 in capsule form. They do not use liquid, because we get iodine 131 in capsule of different denominations. So, it is going to have less hazards as far as spillage is concerned. Iodine 131 is administered in oral solution. Some hospital, they are using iodine liquid form, because they feel this is the method where they can able to dispense the activity of their choice instead of depending on the capsule where the activity is fixed. They have to well assure that vials which are being used for sucking this particular iodine 131, we have to see to it, it has to be washed thoroughly, so that once it drinks, the patient drinks completely, everything should go inside and nothing should be left out. Intravenous administration, because sometimes the patient requires administration intravenously when the patient is in the ward, but you are not given the iodine 131 in the oral form, but you have to intravenously, slowly you have to inject, it should go in a blood pool. There it plays a very important role, because finally that particular bottle from where you are injecting activity, they are all becomes radioactive, the waste being generated. So, put the radionuclide in an infusion bottle line the bottle to the patient using intravenous catheter, keep the patient in bed until the bottle is empty, and remove the bottle and catheter and dispose of the radioactive waste. This particular slide is very, very important as far as the radioactive waste is being generated, because finally the activity has gone inside the patient. It is well mixed with the blood flow. It has gone to the place where it is to be treated. But after the treatment, whatever the bottle, syringe, catheter is left out, they are all as radioactive waste. We have dose limitations for comforter and visitors of patient also. That is why if you see in most of the hospital, we use the term isolation wards. What do you mean by isolation wards? Isolation ward is a type of ward where the patient have to be kept after the administration of activity for a time, because they have to be away from uh, their relatives and the visitors, you can say. But no doubt they are having certain limits being framed for comfort and visitors. But we have to see to it most of the time these patients are not to be in general ward. The dose to the comforter shall be constrained so that it is unlikely that her or her dose will exceed 5 millisievert during the period of patient diagnosis, examination or treatment. The dose to children visiting patients who have ingested radioactive materials should be similarly constrained less than 1 millisievert. It means we have two limits. One is for general public they are coming, and for meeting the patient, usually we try to avoid, and it should be discouraged that during isolation the relatives and friends should not be there. They can come visit from a longer distance and go away, but even if the patient requires some kind of relatives because of their age or because of certain disease, then the limits have been prescribed for them as they are acting as a comforter as 5 millisievert. This particular slide which talks about iodine 131 is when the patient has gone home. This person is a person who talk about radiation safety officer. What exactly he is doing it? He is basically monitoring the patient before the discharge, how much activity is left out in the iodine of iodine 131 in the thyroid and the whole body, and based on the national regulatory limits whether the patient can be discharged or not, because each country is having different limits for discharge of the patients. Like in our country we have 30 millicurie, it means the dose rate is 3 to 5 microsievert. We can able to discharge 30 to 50 microsievert, we should say, we can able to discharge the patient. And this patient has to be monitored and readings are to be noted down, and using second day, most of the cases second day the patient can go home. The radiation safety officer feels that the patient cannot be discharged and he has to be kept in the ward, but if the regulatory limits are been fulfilled, in such case the patient can be discharged. There are different kind of instructions which are to be given. Now when the patient is coming as OPD cases, or in certain times the patient has to be discharged and they have to go and stay with their relatives, that what type of eating habits they should have, where to sleep, how far they have to be away from the children's, what are the different precautions to be taken, like no eating and drinking during the first hours after a treatment. During the following 2 days you should drink more water so that it should be excreted out, and plus 2 to 3 times after every use keep the toilet and the floor clean. Wash your hands frequently and take a shower every day. Avoid close contact with members of the family, children and pregnant women according to the timetable attached. Avoid solid waste, and at the last, contact the nuclear medicine staff in case of any problem or questions. So these type of instructions are usually given, though we used to get instructions when we go for general type of treatment with the doctors, but in case of nuclear medicines, the reason is because it is not because the instructions are to you, but the instructions are to be given to how to protect, how the precautions are to be taken for their relatives and for the friends and the children, etc. Hospitalized patient. Now the patient has to be hospitalized. When we are talking about the patient has to be hospitalized, means the patient is in isolation ward. Separate room with toilet and shower, by separate toilet, and separate washroom is required. It should be attached with that, because when you are going in a general toilet, type of contamination, type of radioactivity is due to. Therefore, in case of isolation ward, the toilet attached should be separate. And what are the patient instructions should be given in verbal, written both cases, because sometimes the patient won't understand your language. So you have to see to it, get the patient understand your language. Always rules should be made in local language for nursing the patient, rules in local language for visitors, rules in local language for decontaminations, rules in local language for emergency situations. It clearly defines that your patient, your relative, the relatives of the patient, the visitors and the staff should know about the radiation, and it should be displayed. The rule should be displayed. It should be verbally informed to them, and if sometimes required, it should be given in writing to them. Now, patient instruction, you have to tell to the patient, see, you have to be in the room, you have to drink as much as possible, so that the dose to the bladder can be reduced, because finally all activity has to be excreted through urine. Eat lemon slices. Why lemon slices? Because lemon slices will help to reduce the doses to the salivary glands. Use only the private toilet and flush 3 times. What does it mean? It means that you have to use your own toilet. The toilet should be attached with the room. And whenever you go to a toilet, you have to flush 2 or 3 times, so that there should not be any contaminated on the place where you are using the toilet and all. Wash hands well with soap water after using the toilets. Wear footwear when leaving the bed. In the event of vomiting or incontinence, notify the nurse immediately. It may happen psychologically because of some other reasons, not because of radioactivity. You may feel like vomiting. You may feel like incontinence. In such cases, you have to notify the nurse immediately so that the proper action can be taken. Now, in the few slides before, we have talked about instructions to the patient, instruction to the visitors, now instruction to nursing staff. Reduce time spent with the patient by planning ahead and working efficiently. Work as far from the patient as possible. Practice preventive measures against contaminations like wear impermeable protection gloves, wear shoe covers, wear a protective gown, and remove protection clothing before leaving the room. These are the instructions to be given to the nursing who is taking care of the patient who is in isolation ward. Now comes to the visitors. Visitor warning card is to be given. So when the visitors, they are not the general visitor who are coming to see the general patients. Basically, they are coming to visit the patient who is in isolated. Usually, it should be discouraged, but because of reasons, they come and they try to meet. The patient you are about to visit has received a therapeutic dose of radioactive iodine. It is in your interest to protect yourself as much as possible from receiving more radiations than is necessary. To assist you in meeting that, and we offer the following recommendations. Visitors are discouraged for a 48 hours period after the patient receives the treatment, because at that time the activity in the body is in much higher quantity. Pregnant women and children under the age of 18 are not permitted to visit, because they are more sensitive. Their ages are more sensitive towards radiations. You should keep your visit short, not less than 30 minutes. Keep a reasonable distance. Usually it has been seen in our country that when the patient goes, when the patient relatives comes in the ward, they used to sit and just start chit-chatting. But the same scenario or same thing cannot be followed in case of patient who is in isolation ward. Do not kiss or touch the patient. Usually we go, when the children is there or elderly patient is there, we try to kiss their forehead. Do not do that. Do not eat, drink, smoke in the patient room. Basically, we try to see to it the patient relative should not enter the room. They should be away. Do not touch the toilet or sing in the patient room. Don't even try to go there. And don't touch the toilet because of any reasons. If we are making as a comforter, if you are taking old patient, don't touch the toilet seat and all, because all contaminated. And any queries you are having, last line it is written, you can ask the nursing staff. Whenever you want to discharge the patient, as I told, that you are going to monitor the patient at a distance of 1 meter, and you will feel that the patient activity or radiation level is about 30 to 50 microsievert, it means 3 to 5 mR. Activity may be in the range of 30 millicurie or 1110 megabecquerel. The patient should be instructed about a general precaution for outpatient. So, when the patient is to be discharged, other instructions are to be given by radiation safety officer to them. Now, suppose a contamination has taken place because of any reason in the hot lab, or maybe when the patient has been administered the activity, patient vomiting, and activity spill is taken place. The RSO should supervise the removal of contaminated waste, the decontamination of the room and equipment, and should make a documented final survey of the room. Monitoring and decontamination must be done prior to entry of nursing and housekeeping staff to prepare the room for the next patient. Third and foremost important thing is, when the survey and decontamination procedures are completed, the RSO will remove the radiation warning sign and notify the nursing and housekeeping staff that the room is now ready for general use. It means it is a duty of radiation safety officer to supervise, and finally when everything is right, to make a sign over there that patient can be used for, that room can be used for other patient. Now, when all these things are happening, when you are treating the patient, when the patient goes home, in case of diagnostic or therapy, there is some kind of waste is being generated. This is not a normal waste, these are radioactive waste. It shall be collected, segregated and disposed according to national regulations and local rules. If it is biomedical waste, definitely local rules have to be followed. If it is radioactive waste, then rules from our regulatory authority has to be followed. Try to avoid solid waste. Do not use paper plates or disposable cups of flatware. We generally people use it because they feel that okay, this is a waste. Paper cups and disposable cups are used. But what exactly? This is going to create a solid waste. So try to use, don't use such kind of plates. It's better to use other steel plates and all those things which can be washed, and so the waste can be minimized. Use regular dishes, glasses and utensils. Wash them in the sink or dishwasher. Tissues and paper napkins should go to the toilet, not in the garbage, because it is going to increase the waste in the garbage. Food residues should be avoided during first week. When you are in the ward, don't eat apple cores, chicken, bones, etc. because activity is being excreted by other means, and it is going to create the cores and chickens, bones and all those things are to be radioactive. Finally, we are increasing the solid radioactive waste. Article contaminated with the body fluids that cannot be washed, clean or disposed of in the toilet should be stored for decay. There are many items like clothes where you cannot just send it for washing or cleaning purposes in the laundry. You have to keep it for a long time till the radiation level comes out, so that it can be used, it can be sent it for washing, and finally it can be reused. In case of death of the patient, now the patient with activity has been died. It is not a simple thing to manage such kind of patients, because that patient body cannot be given to the relatives directly because it is having the activity in that. So, there are certain rules and regulations given by the National Regulatory Authority that has to be followed, and see to it before burial and before cremation, after cremation, it has to be seen to it there are certain guidelines to be followed whenever the patient death takes place. During death of the patient, precaution that should be given are depending on the residual activity and the expert advice given by radiation safety officers, and may involve following. Preparation for burial or cremation should be controlled by a competent person. It means radiation safety officer should supervise such kind of operations. Relatives should be prevented from coming into close contact with the body, and people should not be allowed to linger in the presence of the coffin. All personnel involved in handling the corpse should be instructed by the radiation safety officer and monitored if appropriate. All objects, clothes, documents, etc. that might have been in contact with the deceased must be treated for contamination. It may be expedient to wrap the cadaver with waterproof material immediately after that to prevent spread of contaminated fluids, if any, which is coming out. Embalming of cadavers should if possible be avoided, because we don't want to keep the body for longer time, because if you are going to the embalming of the dead body, basically you are going to get the dose. Autopsy of high radioactive cadavers should be restricted or to the absolute minimum, and don't try to do that because it won't help, because activity is in throughout the body, it is in the blood pool. In summary, we can say that future of nuclear medicine will be dominated mostly by the newly developed diagnostic and therapeutic products, procedures, but we have to see to it as far as therapeutic radionuclides are concerned, we are more worried about it because activity being used in larger quantity. Consequently, there is a need for greater awareness of radiation safety, during practice and monitoring in nuclear medicine department. In the interest of bringing benefits to needy patients, all the safety related measures would warrant utmost attention for implementation and sustenance. You have to be very, very careful as far as radiation safety is concerned, because it may lead to some kind of hazard if not been properly taken care of. Thank you very much.